Assalamualaikum warahmatullahi wabarakatuh. My name is Nabila binti Muhammad with the metric number 066204. So today I will voice over about industrial training presentation. So the placement is at Alper Pharmacy Gombada with my industrial supervisor Nur Arjira Isa binti Zainuddin, academic supervisor Madam Laila Raida binti Zainuddin, and course coordinator Dr. Nafisa binti Hussein. So this is the agenda with the introduction, organization chart, weekly activities summary, mini project, task given, other programs, conclusion, and recommendation. So let's get started. The duration is about 9 weeks, starting from 2 March till 1 May 2025. Then the main placement is at retail department, which is related to the nutrition task, diabetic formula comparison, consultation, and supplement advisors. Others departments such as logistic department and quality assurance department. Let's take a look on the organization background. It founded on 1 February 2002 by pharmacist Lu Su Xiong and pharmacist Hu Fei Song. It is a Malaysian largest prescription pharmacy chain with 3,000 plus outlets, and the headquarters is located at Sendayang Tech Valley since 2020. And it has operation hours 9:30 a.m. till 10 p.m. daily at the Gong Badak branch that located at the Tara Austin Kuala Terengganu and provides professional healthcare services and consultation. The pharmacy vision is for a healthy and vibrant world with the mission to provide opportunities, health and guidance for a better life. Second, to deliver professional services, disease prevention and health improvement center, where the philosophy is to continual improvement in business practice, products and services, and also strive for excellent and highest effectiveness. The company activities include professional health consultations and ethical pharmacy dispensing, also medications dispensing and OTC, which is the over-the-counter sales, and primary health screening, which include the blood pressure, heart rate, blood glucose, cholesterol, BMI, lipid profile and uric acid. These activities include the medical equipment supply and rentals, including the wheelchairs, hospital beds, Ripple mattresses, and oxygen concentration, and also commitment to community health and wellness. The organization chart consists of pharmacy head of department, Nur Muhammad Adam bin Mansur, and junior supervisor dietitian Fatina Dira binti Muhammad Hilmi, supervisor or dietitian Nur Ajira Isa binti Zainuddin, pharmacist assistant Laila binti Yaqub, customer executive which is Nur Khairanisa binti Abdul Rahman and Maizatun Naziha binti Muhammad, and include the health advisor Nur Mahani binti Abdul Hamid, and the intern students which is Nur Maizatun Nabila binti Muhammad, myself and my friends which is Nur Adiba Fakihah binti Saiful Bahari. Move on to the weekly activity summary for week 1 till week 9. So start with the week 1, which is understood our pharmacy workflow and SOP, including stock and patient interaction. Second, participated in briefing session, stock checks, and inventory organization by checking the expiry date. Third is assisted in tidying display shelves and learning product categories. Number 4, explore pharmacy items like dialysis, milk formulas, and diabetic-friendly sweeteners like equals and sugar off. Number 5, engage in medical packing, administrative tasks, promotional setup, and client file tagging. And lastly, review medical history files and attended weekly briefing with the dietitian Ajira. For the week 2, it consists of perform FIFO-based self-stocking, restocking, and product facing. Second, created educational posters and WhatsApps plus for promotion and services. Third, decorated pharmacy for Raya, which is enhancing the festive customer experience. Number 4, studied malnutrition in children, CDC chart, Z-scores and children supplements. Number 6, learn system, ACCS, Zilnex, and explore the CKD and Ferrous 6 Plus. And lastly, design visual materials for milk supplements and engage in promotional planning. Week 3, which is conducted stock tagging, FIFO placement and expiry check. Second, studied glucosamine, chondroitin, and collagen for joint or skin health. Number 3, participated in Silver Care Day, learn about wheelchair and dementia. And number 4, perform health screening, which is the blood pressure, glucose, cholesterol, and interpreted the result. And lastly, created the content, which is video or the poster, acted in pharmacy media, and conducted flow-ups. For week 4, it consists of focus on clinical screening, lipid, blood pressure, and glucose, and also documentation in Octopus system. Second, handle stock duties and shelf arrangement using FIFO and facing. Third, prepare educational content on diabetic-friendly supplement for seniors. Number 4, design promo visuals, TikTok clips, and recipe such as sourdough recipe. And lastly, manage WhatsApp blasts and participated in PWP campaign support. For week 5, it consists of short week due to the Hari Raya holidays. Second, assisted with the stock arrival verification and shelf placement based on FIFO and expiry date. And third, ensure product quality and reduce waste through accurate inventory check. For week 6, it continues stock organization and expiry management. Second, developed a guidebook content on elderly oral supplements and electric wheelchairs. Third, created promotional posters and attended staff meetings for the workflow inside. Number 4, promoted Alpro sourdough with smoked chicken sandwich tasting. Number 5, calculated nutritional content for metabolic basic for the Alpro Foundation's client. For week 7, which is enhanced self-organization and medication packing, then prepared for Alpro Members Day, including the decorations, arrange props, and handle catalog. Number 3, updated WhatsApp and promotional content. Number 4, presented health case study such as vertigo, migraine, kidney stone, and etc. And number 6, which is assigned news project on pregnancy, breastfeeding, and family nutrition. For week 8, it consists of managed stock tasks using FIFO and facing technique. Second, execute Alpro Members Day, decoration registrations, and also customer communication. Number 3, promoted via TikTok and WhatsApp, and also documented customers' data using Excel. And lastly, revised pregnancy nutrition and assisted in capillaroscopy procedure. And for the final week, which is week 9, include the finalized tasks during Alpro Members Day, include registration, WhatsApp updates, and catalog distribution. Second, help customers with product selection and stock management. Number 3, participated in intern farewell, conducted supplement prices calculation, and lastly, completed presentation on obesity and submitted internship guidebook and a diabetes flipbook. So move on to the mini project part. There is 2 mini project and 2 presentation tasks. So let's start with the mini project. The projects are the Alpro sourdough bread, sandwich ayam salai bersama sos mayo bijan, with the objective to introduce a nutritious sandwich menu using Alpro sourdough bread to promote healthier eating habits, to educate customers on the health benefits of sourdough bread through a food tasting activity. Number 3, to support public health promotion while enhancing skills in health communication and product marketing. Introductions. In the recent year, there are growing consumer awareness of nutritious food. The Alpro pharmacies conducted a health promotion through a product marketing task, which is involved the food tasting event that featuring the Alpro sourdough bread itself. And students, myself, created a healthy menu using sourdough bread and smoked chicken with sesame mayo sauce. This purpose is to showcase the taste and the texture of the sourdough bread in a ready-to-eat meal. Second, to promote health benefits of sourdough bread. And third, encourage customer engagement and pre-orders. For the results and discussion, the unique taste created to align with Alpro health branding, with the balanced nutrition using the whole ingredients and minimal processing, and the proportional posters shared physically and via WhatsApp, and the sandwich tasting held on site at the Alpro pharmacy, and we have gained a positive feedback, which is they interested in pre-ordering and to start with the healthy eating. This project improved communication skills and customer engagement, and the feedback is very useful for our future to develop the menu and the marketing plans. In conclusion, we have successfully promoted the Alpro sourdough bread and the sandwich ayam salai, and also engaged customers and encouraged the healthy eating habits. And this show how community projects support the public health, and it's provide the hands-on experience to the students with the nutrition communication, product promotions, and also customers engagement. Next, the presentation task, which is memahami vertigo, punca, mekanisma, dan sokongan nutrisi. The objective are to provide an in-depth understanding of vertigo, including its symptoms, types, mechanism, and associated complication for a health and nutrition perspective. Second, to explore the relationship between vertigo and migraine, including the physiological factors and lifestyle triggers. And third, to highlight evidence-based nutritional supplement and vitamins that may provide the support for the individuals with vertigo, thereby enhancing the non-pharmacological management strategies. For the introduction, vertigo is caused by a false sensation of spinning, affecting the balance and coordination, and it is linked to the inner ear or brain problems, with the symptom includes the dizziness, nausea, and balance issue. So this presentation entitled with the Memahami Vertigo, Punca, Mekanisma, dan Sokongan Nutrisi was held during the internship at the Upper Pharmacy. This is to improve the staff knowledge on managing customers with vertigo and had covered the key topics such as types of vertigo, symptoms, causes, migraine connections, and dietary advice. For the result and discussion, the presentation was well received for its clinical relevance in the pharmaceutical practices, which is explained into two main types of vertigo. Number one is peripheral vertigo, for example, BPPV, vestibular neuritis, and labyrinthitis. And second, central vertigo, which is linked to the brainstem or cerebellum issue, like stroke or tumors. And this highlighted the vestibular migraine is vertigo without the headache that's triggered by stress, hormones, certain foods, and weather. It also emphasized complications if untreated, such as the risk of falls, tinnitus, anxiety, and depression, and introduced a supplement for vertigo vertigo support, which is ginkgo biloba, vitamin D3, acetyl L-carnitine, vitamin B12, and with guidance on dose, functions, and timing. In conclusion, the vertigo affects the inner ears and brain balance center. It can be a standalone condition or linked to other illnesses like migraine, and the early diagnosis and management, it can prevent the complication like tinnitus, falls, and physiological distress. And then the supplements such as ginkgo biloba, vitamin D3, L-carnitine, vitamin B12, and magnesium bisglycinate, it can help to improve the balance and reduce the symptom. And the session enhanced the pharmacy staff ability to provide the holistic care and nutritional advice for vertigo-related cases. The next presentation task is panduan nutrisi dan suplemen sepanjang kehamilan dan penyusuan, with the objective to enhance awareness on the importance of maternal nutrition and supplementation through pregnancy and breastfeeding phases. Number 2, to provide evidence-based dietary guidelines and supplementation practice according to different pregnancy trimester and lactation stages. Number 3, to educate women, especially expecting mothers, on appropriate nutritional management to prevent complications such as gestational diabetes mellitus, GDM, anemia, and premature birth. For the introductions, the nutrition during pregnancy and breastfeeding is important for the mother's health and baby growth and development. The pregnancy causes the physiological changes like increase the nutritional needs. Then, poor nutrition, it can affect the fetal growth, birth outcomes, and infant development. And this topic covered the energy and nutrients requirements during pregnancy, the recommended weight gain, dietary management of GDM, and exclusive breastfeeding practices. For the result and discussion, it consists of a 5-part, which is the nutritional importance during pregnancy. Second, nutrition requirements by pregnancy phases. Number 3, weight gain and energy needs. Number 4, GDM nutritional management. And the last one, number 5, which is exclusive breastfeeding and milk composition. In conclusion, the optimal nutrition and supplementations are crucial during pregnancy and lactation due to its benefits such as prevent pregnancy-related complications, support fetal growth and development, and also promote successful exclusive breastfeeding. The recommendations is to follow a balanced diet, monitor nutritional status regularly, and adapt to guidance from the dietitians and the MOH guideline. The last mini project is the Upper Flipbook, where the objective is to increase the awareness and understanding of non-communicable diseases such as diabetes mellitus, high cholesterol, and hypertension among the public. Second is to provide simple, accurate, and practical nutrition education tools that can guide the community in making healthier lifestyle choices. Number 3 is to support the promotionals of early detection, disease prevention, and appropriate dietary management that related to diabetes mellitus and other health risks. So for the introduction, the non-communicable diseases such as diabetes, high cholesterol, and hypertension are rising in Malaysia. It is due to the poor diet, inactivity, and low health awareness are the key causes. This flipbook was created during the internship to educate the public and also covers the key fact, nutritional tips, and simple diet calculation. And I have prepared the diabetes sections and other covers by cholesterol and the blood pressure. For the result and discussion, this flipbook is created to educate on diabetes, cholesterol, and blood pressure, and it's designed as concise, visuals, and easy to understand for the public. And I have prepared the diabetes section, such as the types, the symptoms, glucose chart, and carb countings. And the teammates covered the cholesterol and the blood pressure. And I've been distributed the flipbook to the pharmacy and also received a positive feedback. In conclusion, the flipbook is effectively shared about the key infos on diabetes, cholesterol, and hypertension, and it increases the public awareness and encourages the healthy habits with the visuals, evidence-based content promoted the early detection, and the student works on diabetes application nutrition, knowledge to real-world education. For the other programs, which is the Upper Members Day, this Upper Members Day was a 3-day health screening event starting from 24 to 27 April 2025 at the Alpro Kombada. About 200 participants joined and some redeemed for free screening and others paid for 10 ringgit only. And this screening is include the blood pressure, cholesterol, glucose, capillaroscopy, and health consultation. And this aims to raise awareness and support early detection, and I helped in registration, welcoming, and assisting participants. For the activity, I have managed the registration booth and confirmed attendance via WhatsApp and calls, and also welcomed participants and assisted in purchase at the pharmacies. Third, promoted the event through the WhatsApp videos and status update. Number 4, rescheduled missed appointment and updated the Excel records. Number 5, acted as the event photographer for documentation and promotion. Number 6, distributed Opera product catalog to the customers. And lastly, the role is to improve their communication, technical, and organizational skill. So I have gained a soft skill communication, time management, and problem solving, and use WhatsApp for communication, Excel for scheduling, and Canva or PowerPoint for visuals. But I have faced challenges like answering unfamiliar product questions and managing appointment changes, and overcome the issue by consulting the staff and updating the documentation. And I also contribute to the post-event reflection to evaluate the strengths and weaknesses. The strength for the event is high community engagement, good teamwork, and informed customers, also effective promotion. While the weaknesses is limited space, missed appointments, and lack of privacy during consultation. So this internship boosted confidence and real-world applications of nutrition knowledge, and I have learned importance of personalized supplements advice in the pharmacy setting, and also suggested improvement for the better space management for future events. So in conclusion, my internship at the Upper Pharmacy Kombada was academically and professionally valuable due to I have gained the real-world experience in pharmacy, nutrition advice, and supplement recommendation. Also applied the classroom knowledge in nutritional assessment, health promotion, and patient education. It also improved my soft skill communications, teams, and time management, and also boost confidence in handling nutrition-related concern. This internship also strengthened my motivation to become a competent and a compassionate nutritionist. For the recommendations, I suggest more structured nutrition-related tasks such as counseling and supplement and planning. Then recommend providing dedicated workspace like test and chair for the better intern comfort. And number third is encourage a small incentive or allowance for intern involved in the public program. But overall, continued support and improved facility will enhance the future internship quality. That's all from me. Thank you.